Our heart is a remarkable engine, a muscular pump working tirelessly every second of every day. It is the very center of our circulatory system, responsible for sending blood rich in oxygen and nutrients to every corner of our body. Cardiac disease or heart disease is a broad term that refers to a range of conditions that affect this vital organ. It happens when something disrupts the heart's normal function, whether it's a problem with the blood vessels, the heart's rhythm, or its structure. Think of it like a sophisticated plumbing and electrical system. If any part becomes blocked, frayed, or weakened, the entire system is put at risk, and the consequences can be serious. Why is this so common? The answer lies in a combination of our modern lifestyles, our genetics, and the simple process of aging. Over time, factors like high blood pressure, high cholesterol, and diabetes can damage the delicate lining of our arteries. Unhealthy habits, such as smoking, a diet high in processed foods, and a lack of physical activity, accelerate this damage significantly. It's a gradual process, often starting silently in our younger years and only revealing itself later in life. Because these risk factors are so prevalent in societies across the globe, heart disease has become a leading health challenge for millions of people. There are several major types of heart disease, each affecting the heart in a different way. The most common is coronary artery disease, or CAD. This occurs when the coronary arteries, the specific vessels that supply blood directly to the heart muscle, become narrow or blocked by fatty deposits called plaque. This process, known as atherosclerosis, is like rust building up inside a pipe, restricting flow. If the flow is reduced, the heart muscle is starved of oxygen, which can lead to chest pain. If a plaque ruptures and a clot forms, it can block the artery completely, causing a heart attack. Another significant condition is heart failure. This doesn't mean the heart has stopped working, but rather that it isn't pumping blood as efficiently as it should. It can be the result of damage from a previous heart attack, long-term high blood pressure, or other diseases that have weakened the heart muscle over many years. Imagine an overstretched elastic band. The heart muscle loses its ability to contract forcefully, leading to a backup of fluid in the lungs and other parts of the body. Other conditions include arrhythmias, which are irregular heartbeats, and problems with the heart valves that control blood flow. Recognizing the warning signs of heart disease is absolutely crucial for seeking timely medical help. The symptoms can vary widely depending on the specific condition, but there are several classic signals to be aware of. The most well-known is chest pain, often described as a pressure, tightness, or squeezing sensation, which may spread to the arm, jaw, or back. This is a hallmark symptom of a heart attack. However, it's important to know that symptoms are not always this dramatic. Sometimes the signs can be much more subtle, especially in women, and can be easily mistaken for something less serious. Beyond chest pain, shortness of breath is another key indicator. You might find yourself getting winded from activities that used to be easy, like climbing a flight of stairs or carrying groceries. This can be a sign that your heart is not pumping blood effectively, causing fluid to build up in your lungs. Persistent fatigue, a feeling of being unusually tired all the time, can also be a red flag. Dizziness, lightheadedness, or even fainting spells could point to an arrhythmia or another underlying heart issue. Swelling in the legs, ankles, and feet is another common symptom, particularly associated with heart failure. When you present these symptoms to a doctor, they will begin a careful diagnostic process to understand what is happening inside your heart. This journey almost always starts with a thorough physical examination and a detailed discussion about your medical history, family history, and lifestyle habits. Your doctor will listen to your heart with a stethoscope to check for abnormal sounds like murmurs, which could indicate a valve problem. They will also check your blood pressure and pulse. This initial conversation provides the essential groundwork for determining which specific tests are needed to get a clearer picture of your cardiac health. To look deeper, doctors have a range of powerful diagnostic tools. An electrocardiogram, or ECG, is a quick and painless test that records the electrical activity of your heart, helping to identify irregular rhythms or signs of a past or current heart attack. For a more detailed look at the heart structure and function, an echocardiogram is used. This is an ultrasound of the heart that creates moving images, allowing doctors to see how well your heart's chambers and valves are working. Blood tests are also vital. They can measure levels of certain fats, cholesterol, sugars, and proteins that are associated with a higher risk of heart disease. Once a diagnosis is confirmed, the focus shifts to treatment. which is tailored to the individual and their specific condition. The foundation of nearly every treatment plan involves significant lifestyle changes. These are not merely suggestions, but powerful medical interventions in their own right. Adopting a heart-healthy diet, rich in fruits, vegetables, whole grains, and lean proteins while low in salt, sugar, and saturated fats is paramount. Regular physical activity, aiming for at least 150 minutes of moderate-intensity exercise per week, helps to strengthen the heart muscle, lower blood pressure, and improve circulation. Quitting smoking is the single most effective lifestyle change you can make for your heart. Medication plays a central role in managing most heart conditions, working alongside lifestyle adjustments to control symptoms and prevent further damage. There are many classes of drugs designed to tackle different aspects of heart disease. For example, statins are widely prescribed to lower high levels of LDL, or bad cholesterol, which reduces the buildup of plaque in the arteries. Beta blockers and ACE inhibitors are used to lower blood pressure and reduce the strain on the heart, making them essential for treating hypertension and heart failure. Blood thinners like aspirin or other anticoagulants are often used to prevent the formation of dangerous blood clots. For many patients, especially those with significant blockages in their arteries, medical procedures or surgery may be necessary. One of the most common interventions is angioplasty with stenting. In this minimally invasive procedure, a cardiologist guides a thin tube with a balloon at its tip through a blood vessel to the blockage. The balloon is inflated to push the plaque against the artery wall, and a small mesh tube called a stent is often left in place to keep the artery open. This restores blood flow to the heart muscle immediately, providing rapid relief from symptoms like chest pain. In more advanced cases, more invasive surgery might be required. Coronary artery bypass grafting, or KBG, is a major surgical procedure where a healthy blood vessel from another part of the body is used to create a new path for blood to flow around a blocked artery. For individuals with severe arrhythmias, a pacemaker, a small electronic device implanted under the skin, can send electrical pulses to regulate the heartbeat and ensure it doesn't beat too slowly. These treatments, from daily habits to complex surgeries, represent a powerful arsenal that doctors can use to manage heart disease effectively. The most powerful strategy for mastering cardiac health is, without a doubt, prevention. While we cannot change our genetics or our age, we have tremendous control over the lifestyle factors that contribute to heart disease. Building a defensive wall around your heart begins with what you put on your plate every day. Prioritize a diet centered on whole foods, colorful fruits and vegetables, fiber-rich whole grains like oats and brown rice, and lean protein sources such as fish, chicken, and legumes. At the same time, make a conscious effort to minimize your intake of processed foods, sugary drinks, and anything high in trans fats and sodium. Movement is medicine for the heart. Engaging in regular physical activity is non-negotiable for cardiovascular wellness. The goal should be to get your heart rate up, whether through brisk walking, jogging, swimming, or cycling. Consistency is far more important than intensity. Finding an activity you genuinely enjoy will make it easier to stick with for the long term. Exercise not only helps with weight management, but also directly lowers blood pressure, improves cholesterol levels, and reduces stress. Think of it as a daily investment in your heart's strength and resilience, paying dividends for decades to come. Managing the silent risk factors is another critical pillar of prevention. This means knowing your numbers. Regular checkups with your doctor are essential to monitor your blood pressure, cholesterol levels, and blood sugar. If any of these numbers are elevated, you and your doctor can create a plan to bring them back into a healthy range, which might involve diet, exercise, or medication. Similarly, managing stress through techniques like mindfulness, yoga, or spending time in nature can have a profound and positive impact on your cardiovascular system by lowering stress hormones that can strain the heart. Finally, making a firm commitment to avoid harmful habits is fundamental to protecting your heart. If you smoke, seeking help to quit is the most impactful step you can take for your health. The benefits begin almost immediately as your blood pressure and heart rate start to return to normal. Limiting alcohol consumption is also important, as excessive intake can raise blood pressure and contribute to weight gain. By embracing these proactive strategies, eating well, moving regularly, knowing your numbers, and avoiding toxins, you are not just preventing a disease. You are actively building a foundation for a long, vibrant, and heart-healthy life.